Good morning, everybody. This is Ken Epstein. I want to welcome you to this talk. And I just wanted to start because of the realities of Zoom. I wanted to start by if you just would be so kind to put what you do into the question and answer. So if you could just tell me so I can, since I can't see you, I can know who you are. If you just put into the question and answer, who you represent or what you do, so I can look at that for a second. Well, I'm seeing none, so I'll just move on. Richard, you can hear me okay, right? Just give me a thumbs up. Okay, great. Thank you. Well, good morning, everybody. So I'm here to talk to you in the next 35 or 40 minutes about the work that you're all doing and to see if I can be helpful. I wanted to start by just introducing myself. And I'm going to introduce myself a little bit differently than most often people introduce themselves. I mean, you can imagine I've been in the field for a while, but really what I want to do is make a disclosure. I never have any disclosures that have anything to do with working with pharmaceutical companies, but I realized I do have a disclosure to make every time I speak, and that is that I am a white man, privileged, middle class, have a job, have a home. I am Jewish, I'm in my 60s, and I'm the middle generation of 3 generations of social workers. And why I disclose that about who I am is because who I am as a leader and as a person impacts what I think and what I do. And as I'm giving this talk today, I would hope that we would all think about who you are, where you come from, how you lead, how you work, and how that impacts the work we do. And I call this the mirror and the landscape. Because the mirror is, first we need to interrogate ourselves. Who are we? What are our biases? How do we enter into this conversation? We're very used to othering, thinking about the landscape. Who are they? What's happening there? How they're messed up, or what's going on with them, or how do we do something with them? And I would argue, and this talk is really centered around, until we interrogate ourselves actively, constantly, and consistently, we will be subject to making mistakes over and over again from our bias, and particularly if you are from a privileged and or dominant or white supremacy perspective. I want to just enter into this conversation in context. And as I do this, I give all of you listening a trigger alert. If something I'm saying, because we're talking about trauma, triggers you, turn the video off, turn the sound off, take a breath, because we're in a moment. And it wasn't that we weren't in a moment before there was COVID or before our country hit and face our racial reckoning, or before smoke and fires maybe chased us out or evacuated us or lost our houses. And as we all enter into, at least in my life, the election of my lifetime, and then question mark, what else has happened in our lives? The context is important because I'm on Zoom talking to you and not being able to see you. Many of us have lost people and not been able to be with those folks, and many of us have changed our lives. And this moment is both one to mourn and to see the opportunity. And today's talk will be thinking about this moment of time. But before I begin, I want to start with a land acknowledgement. We acknowledge that we're residing on tribal lands of those who have lived on this land since time immemorial. We pay respect to their elders, past and present. So please, please take a moment to consider the many legacies of violence, displacement, migration, and settlement that bring us together today. We recognize we recognize that the resilience is those past and present who work to build strong and sovereign nation where tribal members live their values and culture. And you can see, if you're interested, that if you want to find out what land you're living on that was confiscated from or from a sovereign nation, there's a number at the bottom. And in that, I want to acknowledge that we're fighting a disease together that doesn't have a treatment or a vaccine. The pandemic is new, but we know the inequities it unmasks or not. There's a moment, racial justice challenges the status quo and also creates opportunities. We're holding multitudes of fear, feelings, overwhelm, grief, rage, all at the same time. And there are a multitude of responses to stress and uncertainty, and each of them are valid. There's a critical need for reflection, inquiry, prioritization. And there is no better time, and I can't say that any more strongly, there is no better time to practice compassion and collective care than right now. So during the talk, I'm going to give you just some tools for your toolkit. And I know that in our work with children, youth, and families, we often launch into a story about how a family or something's happening, or a legal lawsuit, or a compliance issue, or the challenge of a kid. And as we're doing that in the meeting, our breath, our heartbeat, the way we are is getting louder and louder. And I worry that even on Zoom, we're doing that more and more. And so the tool for your toolkit is that we should start with a breath. We should start with a check-in. And so now I'll just do a quick check-in for you. You might see a number 9 kitties on the screen. Why don't you just look at it and think, what kitty are you in isolation today? I'm just telling you, I'm number 5, always number 5, just wanting to get in the refrigerator. But where are you? What's your temperature check today? Because your temperature check impacts your psychological impact. Temperature check impacts how you're going to function in a meeting, how you're going to participate, how distracted you are. I know for myself, I am constantly trying to stop myself from checking CNN to see what the latest news is. It's become problematic for me. What's distracting you as you're trying to do your work and go through your life? These distractions are important for us and also for the children, youth, and families and the teams we work with. So tool number 2 is that in the time of all of that context, I find I have a plan A and a plan B, and often my plan A doesn't work because there is something that's happened, something that's going on, unpredictable, and we're going to talk more about this in a second. And as people, as leaders, as workers, as families, we need to understand that this is a time that we need to really have a lot of flexibility and understanding of what we're expecting to get done and what's going to get done. We enter into this period facing the same storm, COVID, but I need to say we're in different boats. The doses of adversity relative to homelessness and access to healthcare and systemic racism and police brutality and xenophobia create differential experiences as we all face this pandemic and our racial reckoning, the election, fires, and whatever else is going on. And what this means is that we have to understand that everybody we're sitting with and everybody even on this webinar are not experiencing the same thing. When people say, oh, we're all going through this, the truth is that's true and not true. I'm sitting in a safe home. I have a safe place. That's not true for many people, both on this Zoom and the folks we work with. And as we're talking about our original sins of our country, both the confiscation and annihilation of our indigenous members of our community, we are also facing a reckoning around structural and racial violence and anti-Black racism. And in this moment, as we face our 2 original sins, we need to reckon with the fact that everything we do needs to come from the lens of racial justice and social justice, because there is no trauma informed without racial and social justice. They just do not happen separately. We have lost too many beautiful people due to structural violence. And this moment is a time where we need to ensure that we are integrating this lens into everything we do. So in summary of these thinkings, I think Naomi Rachel Remen said this best. The expectation that we could be immersed in suffering and loss daily and not be touched by it is as unrealistic as expecting to be able to walk through water without getting wet. And what this means for us collectively is that we're facing collective grief. Grief is not an abnormal part of human experience. It's actually a part of all of our human experiences. But we are, as a nation, as a world, we're facing collective grief, which is a natural reaction, and yet one in which is shared by all of us. Those of us that have lost loved ones, that can't visit loved ones, can't have weddings or ceremonies or anniversaries or travel, to those that have lost people to COVID, to those that have lost their jobs. Many of us, almost all of us, have lost something, and we face a collective grief, loss, and rage. And I ask the question again for your toolkit: what have you lost? And what have you found? And these questions are not just important for you listening to me, but these questions are important for the staff and teams you work for, and for the children, youth, and families we work with, the teachers, all of us thinking about what's going on for us collectively. And that collective grief impacts our ability to actually move forward and sometimes can paralyze us. But before all of this context, trauma was already the #1 public health issue. I'm sure I'm not going to tell you that stress is linked to the 6 leading causes of death, that it impacts more than just the individual, has a ripple effect for communities, and disproportionately affects poor. And we know from COVID, Black and brown people not only get COVID more consistently, but are dying from COVID more consistently. And these kinds of inequities are baked into our system because of the inequities in our system. And there's an intergenerational transmission of trauma. And yes, what we're going to talk about next is that actually it is in our systems, and we need a preventive and systemic approach to address it. So as I promised, I speak New York fast, but I'm going to go to New York slow now. And I'm going to just ask everybody, you can, space out for a second, but I'm going to do the 4-1-5 breathing. And then I'm going to do the rest of our presentation. The 4-1-5 works that you breathe in for 4, you hold for 1, and you breathe out for 5. So I'm going to do 2 versions of that. So breathe in, 2, 3, 4, hold for 1, breathe out, 2, 3, 4, 5. Second time. Breathe in, 2, 3, 4, hold, breathe out, 2, 3, 4, 5. I know this is biased by my zip code, my area code 415, but it just works really well. And it also is science. If you do this in the middle of a meeting, any meeting, you slow our heart rate. You bring people back in the room. You get people off their CNN. You get people from their distractions, and it takes about 30 seconds. So the rest of the time, I'm going to talk about specifically trauma-informed systems, or the idea of culture change in our organizations. Trauma is really popular right now. As a person that's worked in the field as a leader, a clinician, academic for over 3 decades, trauma is not new to myself as a social worker. We've known about trauma since at least, white professionals have known about it since Freud, but cultures and of all, cultures across the world have known about trauma since time began, and have had all sorts of ways of treating and dealing with community and personal trauma. But in the last couple of, last decade, trauma has become so powerful that, everybody gets a trauma training, and there are all these different words. And in fact, it's become legislated. I was talking to some folks that work in aging services about 6 months ago. And in the Older Americans Act, when it was reinitiated, they put in a line that all nursing homes needed to be trauma informed. And the audience had no idea what trauma informed was, and they were worried they were going to be, audited about it. So it's legislated. I know in CCR and some of the early continuum of care reform, some of the early procedures, I know there was something called, that we need to be trauma informed, evidence-based, and short-term. It doesn't exist. It's an idea. There isn't an evidence-based, short-term, trauma-informed model that reaches that kind of intensity. So we have to be careful when we throw out the words trauma-informed, because what's going to happen is, as happened, a number of months ago, somebody said to me, oh, trauma-informed is just the flavor of the day. Or even worse, somebody said to somebody else when they were doing something, that's not trauma-informed. It's not actually an adjective. Being trauma-informed is understanding the impacts of trauma and understanding that trauma happens in the context of relationships. Trauma happens in the context of relationships. And if trauma happens in the context of relationships, then it must be healed in the context of relationships. It is not a tool, a screen, a training. It is about actually relational healing. So organizationally, I don't know about you, but I worked for many years in San Francisco, and this says anyone has any bold initiatives they'd like to unleash. San Francisco is a city of initiatives on steroids. We've been trying to solve the same problems. With new initiatives for many years. And we get initiative weary. And there's a way in which even this becomes sort of organizational trauma, and it gets embedded in the organization. And you start to see things like this, and I don't know if you're, I didn't have much success before with the question and answer, but I wonder what you're seeing now. If you wanted to put in what you're seeing on this picture. Well, you might have been seeing a shark or dark waters, or you might have been seeing a fin or dangerous waters, danger. Often we look at what's above the surface, and that's how we make decisions in organizations, with families, with children, in IEPs. We deal with the behavior, and we look for quick responses to what to do, but we don't look under the water. And under this shark, we see a goldfish. And that goldfish represents really the complexity that we need to address trauma. Trauma is a complex organizational, personal, and family issue, and it needs us to ask and be curious about what's underneath the surface. Otherwise, we'll make reactive responses. Organizationally, you might see stresses like these. You might be seeing no time for collaboration or supervision. I work with a lot of pediatricians, and they, over and over again, pediatricians have been telling me that, there's only so much you can do in 15 minutes. And I heard that over and over again. There's only so much you can do in 15 minutes. And it made me wonder, What's the science of working for 15 minutes with as a pediatrician? Given that they're using evidence-based practices, is there any evidence that they work in the 15 minutes they have to work? So as you think about organizational stressors, you begin to think about the ways in which we build structures that actually don't match our capacity to do it. And of course, we face budget cuts and client needs versus regulations and technology concerns and legislative concerns and staff turnover. And now, of course, even how do we work at home and those of us that go in and how do we build teams together? These all create an enormous amount of organizational stressors. And you begin to see that organizations begin to have symptoms. So according to this, we developed the trauma-informed systems principles, which you see in front of you. And these principles are a guiding force for how you might begin to see and begin to treat your own organization in terms of culture. Understanding trauma, because what we don't understand, we can't do. Cultural humility, responsiveness, safety and stability, compassion and dependability, collaboration, empowerment, resiliency and recovery. And remarkably, these are very similar to the 10 core principles of the system of care. Because when you think about the system of care, when you think about the organizational structures, what we want in the organization, and then what we think needs to happen with the children, youth, and families, well, what are we saying? Well, we're saying they need to have voice and choice. We need to incorporate their supports and their natural supports. Well, we need to collaborate and team and be community-based and culturally competent, individualized and strength-based. All of these principles have been principles since 1986, and we as a system have been trying to implement these into the core of our work. And yet, over and over again, we have to re-legislate these principles because I would argue our organizations are not necessarily able to incorporate them or implement them because of the ways in which our organizations are impacted by trauma. You know, where you see this is that when I started in 2012 in the Department of Public Health, my director then, Barbara Garcia, asked me why I would start in my 50s in a director position as of behavioral health for children. And I told her that what I had found was that over the years, we had made incredible advances. I mean, the lives of children, youth, and families are very different in the system than when I grew up in the system and worked in the system. We're not hospitalizing kids at the rates and taking kids out of their homes at the rates we used to. We're decreasing the populations in probation, and all of these things are great. And we have evidence-based practices. And yet, in San Francisco, the disparities between Black and brown and white kids in terms of their outcomes were worse, not better. So how do we understand that, that dual experience? And what I said to her is that I believe that our organizations were trauma organized as designed by Sandra Bloom in her great books about sanctuary. That they're reactive, they're reliving and retelling and avoiding and fragmented. And then we need to do something about it because it induces trauma in the staff and the culture of the agency and us versus them. And she said you should just train the organization. And I found out there were 9,000 people. So we developed a training, which we called our trauma-informed systems training. And it was based on understanding the nature and impact of trauma and recovery, shared language, recognizing sociocultural trauma. And, you know, we've trained, well, all of DPH by and large, and you know, maybe 20,000 other people. And I could talk to you about the training, about how people like it and love it and do this and that. But the truth is the train and pray method is not the answer, to how we're gonna, solve this problem. And what I mean by train and pray, it's a little bit what I'm doing today. Training you and praying that it has some impact. It's important, but it's a railway station onto a healing organization. And the sort of the bottom line for today's talk is we are in the healing professions. We're in the teaching professions. Trauma happens in relationship, it's healed in relationship. And therefore we ought to have organizations that are monitoring and working on the healing within our organizations. Are organizations reflective? Are we making meaning out of the past and growth and prevention oriented? Are we collaborative, equitable? And are we using relational leadership? And I ask you to wonder, I wonder with all of you, what's being measured in your organization? Where are the priorities? I know where I worked, it was productivity, efficiency. These words are not even words that come out of the healing field. I'm not productive with somebody. It turns out, actually, I engage somebody I'm working with. And you know what? It turns out you can bill for engagement. Just like, and I can ask somebody how their engagement's going and how come their engagements are so low. And I'm talking about healing words, and I'm still talking about how the billing is going. But we have adopted a whole set of language that comes from making widgets. And so part of this, I was asked the other day, what does it mean for an organization to be trauma informed? And I said, you have to change everything, because the language that we have adopted induces trauma and does not reflect our mission and our purpose. So that's how we might reduce trauma. And the method of doing that is by training, having a learning organization, trainings, building capacity for champions and catalysts to begin to change the culture. And some of the ideas around that include things like participatory decision-making, or cooperative inquiry, or taking data and having people reflect on the data and having data reflection cafes, or having check-ins in the beginning of meetings so that people can do a temperature check, having wellness spaces, or in the time of Zoom, somebody told me the other day about that they're doing random meetings with each other to connect people during coffee breaks. These are important parts of having an organization that embeds relational practices into the body and the work of the organization. Because if the organization doesn't feel like what we need to do for our families and children and youth, then we are not able to actually meet our mandate and our mission to heal and help. So I want to give a summary for your toolkit, and say that there are three basic constructs I'm talking to you about today. And the first one is connecting. When the pandemic first hit, we believed, and we took the Missouri model of pandemics, and it talks about the 3 R's of readiness, response, and recovery. And readiness and response, we added a school violence R in terms of renewal. We talked about the 4 R's because we thought that the pandemic would be 3 or 4 months. We thought that people needed to connect with where they were in the continuum of getting ready for the pandemic, or responding to it, or then recovering, and then building some renewal and rebuilding our way of being. The truth is, the pandemic is unending, and connection is important, ongoing. So here's a connection question that you could ask and put a tool for your toolkit. You could ask somebody in a check-in, not therapy, in a check-in, as opposed to how are you, you can ask them, how are you holding up? An assumption of adversity, because the how are you gets into the hero part of myself. But the how are you holding up gets into the reality part of myself, and I'm connecting to your adversity. And I can say whatever I want in response. And coherence, trauma is about chaos. Trauma induces chaos in us. And the truth is, if we want to have coherence, we have to make, if we want to have, if we want to have coherence, we have to address the chaos. So a second question you could ask is, what's on your mind? Because what's on my mind might be the fact that I can't see my mom in New York, or I can't do this, or I can't do that, or I've lost this. I need to get in the room. I need to make coherent out of the chaos. I need to be able to be present. I love Miles Davis, so that's my point of coherence. So the second question is, what's on your mind? And the third part is about collaboration, which was embedded in all of those principles. Simple question, what helps you? What helps you? How can I help? Not therapy, check-in, 5 minutes, 10 minutes. This is a very brief form of reflective supervision, reflective consultation, and reflective practice. We can do it in a staff meeting, We can do it in an individual meeting. We can do it with our children, youth, and families. We don't have to fix it, but we need to hear it. And by hearing it, we can help people feel heard. So in summary, Sengi said, people don't resist change, they resist being changed. And an example of that, I think, you know, in the time of COVID, is I must be growing up. I caught myself washing my hands without being told to. There's a sense when we get into a more authoritarian, response-oriented, problem-solving, reactive environment that we lose track of the fact that our folks, everybody has efficacy, our children, our families, our staff, our teachers, and we begin to treat everybody as if they can't wash their hands. And the truth is, we won't wash our hands until we believe that that's going to be best for me. And we don't resist change; they resist being changed. So I want to stress that participatory, collaborative inquiry, reflective practices, even in the space of reactivity, are the only source for healing trauma. Trauma is not healed by reaction; it is healed by reflection, and reflection is the key to change. And we have to do that in our organizations, in our meetings, in our times together, and every place we can put it in, because if we don't, we'll live in reactive spaces. I want to thank you so much for your time today, for the ability to listen and the work you do. I want to also just have incredible gratitude for what you've done, what you're doing, the lives you're saving. We are in a moment, I believe we're in a moment where we can actually make substantial change. In my lifetime, this moment, I think, represents the greatest opportunity to address racial injustice, anti-Black racism, the ability of our organizations to take humanistic and reflective and relational stances, and I think, as Nelson Mandela said, to work from our hopes and not our fears. I thank you, and I know there may be some questions, or there may be a time for a couple of questions.
Ken, thanks very much. It's Richard. I really appreciate your always thoughtful reflections about trauma and equity and what organizations can do about that. While people ponder on potential questions, which we have ample time for, one or two thoughts popped into my head, and you've given us some really nice ideas about kind of organizational movement, if you will. I love the 3 C's reflection. Could we invite you to dig a little deeper on maybe 1 or 2 of the most important things that a manager or an executive within an organization might be able to do to determine if their organization was, genuinely trauma ready? What, in terms of organizational readiness and maybe self-assessment for the organization, could you reflect on that a little bit?
Yeah, that's great. Thank you, Richard. I think there are 2 things that I would do first. One is the leadership engagement is critical. I think you all know that if leadership is not engaged, then change will not take place. So the first thing, before we put out surveys and ask questions and do assessments, it's very important to have a meeting of leadership and assess your capacity, your bandwidth, your ability, your support, your principles, and your practices around supporting an effort to transform your organization. And I think it's the will. My friend Ken Hardy often says it's the will that comes first before the skill. And I think often we focus on the skill before the will. So the first thing, Richard, I would say is leadership engagement and leadership conversation. Sometimes that can happen internally. Sometimes you need to bring a facilitator to help you talk that through. The second thing is there are a multitude of organizational assessments. I mean, there are so many. Some you can find on traumatransform.org, but you can look around. There are a multitude of organizational assessments that you can use that will give you a capacity assessment and an understanding of where your organization is. And the second step is I would establish a group of early adopters and folks that do that, assessment with, and then look at it together. And that's where those data reflection cafes come in handy, to not just take the data and say, let's do this, but to take the data and look at it and understand it and digest it, talk about it, think about some small acts of change you can do. Maybe do some plan, do, study, act, sort of small acts of change in parts of your organization to see if you can create some culture change. An example is at the Department of Public Health, the home visiting nursing organization part of it decided to work on respect, because they saw in their capacity assessment that their staff didn't feel respected. And for 18 months, they just worked on trying to raise the feeling of staff of feeling more respected. And they raised the feeling of staff feeling more respected by 27% in 18 months. That's remarkable. So taking something, working on it together collaboratively, begins to build muscle around changing other parts of your organizational culture.
Love that. Thank you. Ken, there is a question from Lisa. Can you talk a little bit more about structured frameworks or capacity assessments which may support successful organizational trauma and reflection? You just mentioned one or two, and then there's a lovely reflection from Lori Clark about the very early introduction to mirror and landscape. So really appreciate that, Ken.
Mm. Okay, so I think I answered part of the question. I don't know if the person wants to ask a more follow-up, but I would say where I quit, because I only had a little bit of time and I quickly went through, there is a using implementation science. I want to just focus on implementation science as a way of thinking about organizational and culture change. If you're not familiar with implementation science, Fixon is one of the folks you'd want to look at, but it's a basic, it's common sense, right? So you need to have leadership engagement before you do training. Don't do the train and pray thing. You need to do training when you're prepared to do something about the training. So you need an assessment before the training. Once you do the training, it's good to build capacity in your organization so you're not relying on external people. You don't want to hire consultants from other places and spaces to do all this work. You want to build the capacity internal to your organization. So you train trainers so that you have the capacity. And trainers are not necessarily, they could be clerks, they could be social workers, they could be administrators, they could be IT people. They just need to be able to stand and deliver and understand and be champions for this work that from the workforce. And then, of course, once you have training and trainers, you need to have a learning community. And we often call that TILT, which is a group of leadership and champion line staff together, working and learning and developing plans to change small acts of change within the organization, building wellness space, changing communication patterns. And then you need to have an evaluation function, and you need to assess your policies and procedures using a trauma-informed and equitable tool, because embedded in your policies and procedures are implicit and explicit inequities. The way your HR works, the way your finance works, the way people are promoted. So ultimately looking at the whole policy and procedural part of your organization. And that would be the implementation science model of thinking about organizational change.
Makes great sense. Ken, really appreciate it. One more question quickly from Lisa before we go to break. Is there a place where we can go to get a little more information? Would you reference a certain website?
Yeah, so I think you're going to get this. Thanks for telling me about my last slide. I think you're going to get this PowerPoint. I think you can go to traumatransform.org. You can go to healsanfrancisco.org, which is an organization we developed at post-COVID. You can look at the National Child Trauma Stress Network, but I think you could see a lot of resources on traumatransform.org or healsanfrancisco.org, or you just contact me. Great work. If you don't know Laura Van der Noot-Lipsky's work, Trauma Stewardship on vicarious trauma, I really, really, really recommend you take a look at that.
Ken, thanks again. A huge Breaking Barriers thank you and appreciation for bringing your wisdom forward this morning. Love this.
Pleasure. Okay, have a great break, and you please take care and be healthy.
Thank you, Ken.